Johnny. So today we're going to be teaching you how to properly do CPR. The first thing is to look over the situation. If the patient is on something like a bed or something soft, you're going to need to actually remove them from that situation because you can't do proper CPR technique on something soft like that. You actually need to be on a hard surface like the ground or at least a table or something like that. So basically just going over the proper technique is you're going to take either hand, whichever is more comfortable, and you're going to interlock your hands. You're going to be in between the chest right here, the sternum, and then what you're going to do is you're going to press down about 3 inches and then back up, okay? Going over the situation more, you're going to need to be listening and watching. So the thing is that you're going to need to be listening for possible, they may have gotten something stuck in their throat and they may be wheezing. You need to make sure that their airway is fully open by lifting up the chin here to make sure that you open up their airway, because if you're sitting here going like this and their airway is blocked, that's not going to help. So you need to have a second person give them instructions to tilt the head up so that way it opens up the airway. Okay? And so then what it is you want to get in a proper position over the person so that way you can use enough force. What you're going to do is you're going to be pressing down like this. You can use the beat of, I guess, staying alive, or just keep an even, steady pace, and you're just going to now when you're doing this on an actual person, you will hear things on the chest and everything like that. You most likely will break ribs. That's okay. That's better than them, being dead. So what you're gonna do is continue that, and once you feel that you're too tired, you can switch off, but you're going to need to let the second person know, have them get into a position where they're ready, and then what you're going to do is you're going to be going like this. You're going to say, hey, I'm getting tired, can we switch off? Do you want to get ready?
Okay.
Alright, and then so you just go on 3, ready, 1, 2, 3, and then they're going to switch over. I'm going to go back over to keep the head tipped up, okay? Okay?
Okay, that was good. They're dead.
Alright, so going over to the AED, what you're going to need to do is there's 2 pads. One goes up here on the chest, and another one goes down up on the side. You do not want them touching because an electrical current will go through there. And then also, so basically if somebody's wearing a shirt, it's okay to rip it, it's okay to cut it. What we can do for this is you can actually just slide it underneath the shirt. It doesn't matter which pad it is. They're interchangeable. Just make sure that you're putting one up here and one down here. You want to make sure it's on the person, the right top side and the left bottom side. You need to pay attention to make sure if they have a pacemaker, there's going to be a small bump right here, and you need to make sure that it's not in contact with that, or else it will wreck that. So what you do is you can just slip this here, make sure that it's nice and on there. So what's going to happen is you need to check to make sure that there's no injuries or bleeding or anything. And also, especially with men, they have very hairy chests. If you do have a specific kit that you can take, and you can actually rip off the hairs on it before you place it, because you need a very good connection, or else it could actually cause burn marks on the patient. So then you take this one, put it right here, and then you just put it down there, and just make sure they're both there. What you're going to do is you're going to turn it on. Most of these will talk to you.
If the patient is a child, press the child button.
Alright.
Do not touch the patient. Analyzing heart rhythm.
You want to make sure everybody is clear. Give a clear signal. Say, everybody clear.
Analyzing heart rhythm.
So what you can do,
advised.
so you can go like this.
Do not touch the patient.
You need to get off of
Everyone
him.
clear.
Everybody needs to be clear.
Press the flashing shock button.
You'll actually need to press the shock button
Press
if you would.
the shock button. Shock delivered.
You'll actually kind of notice the
Begin
body kind of
CPR.
jump a little bit. And so then what you're going to do is it actually helps you.
10, 20, 30. Give 2 breaths.
And we actually do not give breaths anymore. It's just continuous.
10, 20, 30. Give 2 breaths.
You won't give breaths. That's just the old system. And usually the machine will advise again for shock or not. It'll be checking for
30. Give 2 breaths.
So what it'll be checking for is basically if the heart is out of rhythm, it's going to be checking for that and advising if it needs to shock again or not. Just continuing the constant pressure, and then like I said, once you get tired or your form, if you notice that person's form's getting off, just switch out
30.
so that way they can
Give
take
2 breaths.
a break, okay? And then, like I said, just make sure that you're evaluating the situation. If it's at a car accident and you pull them out of the vehicle, make sure they're not in any water or like standing water or anything like that. And also, just like I said, do a full assessment of the body. Make sure there's no
30.
bleeding
Give
injuries,
2
anything like
breaths.
that, because you need to attend to those first before you actually start doing CPR. Well,
Stop.
you can
CPR.
actually
Do not touch
tell
the patient.
another person, say,
Analyzing
hey,
heart
you need to
rhythm.
address this while I do CPR, because while you're
Do not
doing
touch the
CPR,
patient.
that blood's just going to be
Analyzing
gushing out.
heart rhythm.
So you need to make
Shock
sure that
advised.
you address the whole
Do not
patient.
touch the patient.
So-
Everyone clear.
What's that?
Press the
Yeah,
flashing
you can turn
shock
it off.
button.
All right.
So we'll turn it off now, but so
Yes.
Press
Stop it
the
a
shock
sec.
button
Stop, right.
now.
you just
Hold it.
yeah,
Stop recording.
Press the shock button now.